felt like an old man. Stairs, a walk of 30 feet was painful. Everything was painful, and I wish I would have done it earlier. At first, I didn't even know it was my hips. I had lower back pain and pain in my groins. After a fall, I had gotten x-rayed, and they said that my hips were in bad shape, and they recommended replacement. I've had friends, my brother had his hip replaced, and it was done posterior. They cut through the glute muscles. The recovery is much slower. The restrictions are much higher. You don't have nearly as much independence during the recovery, and that was important to me. I went in to see Dr. Parcells. I did some research. There's not a lot of doctors in the area that do an anterior approach, and that was really important for the recovery. So I did some research. I found him, explained the procedure. I had a lot of confidence in him. I liked his attitude. He was highly qualified by where he trained, and he specialized in just hips and knees, so that meant a lot to me. And he explained the procedure really well, explained the recovery, what to expect, and it was actually easier than I thought. I'm still recovering, but I can walk without pain. I can move around and I can go food shopping. I'm not up to sports yet, but I'm definitely feel a lot better. I've been pain-free for the first time in quite a while. I went for a consult in the city, and when he found out that I had my hips done with an anterior approach, he was surprised anybody would try that on a man with my frame and my muscle tone. They said it's a very difficult procedure on a bigger guy. They have to move all the muscle to expose it for the anterior approach. And he asked a lot of questions about the doctor. He was very impressed.